Hello there, and welcome to the latest Atlantic Health System Community Conversation. My name is Luke Margolis. I'm the Corporate Communications Director at Atlantic Health System. And today I am pleased to be joined by Dr. Tyree Winters. He is a physician with Atlantic Medical Group and the Medical Director of the Pediatric Health Start Clinic. Dr. Winters, thanks for coming in today.
Thank you so much for having me. I really appreciate the opportunity to be here.
Awesome. So as folks have undoubtedly seen by the title of this presentation on Facebook, you know that we're going to be talking about a lot of really important back-to-school information for parents and caregivers and students alike to know about. Before we get to all that, though, I want to just give a little bit of information about how this will work.
Sure.
And start with a little bit of a weather advisory. As all of you know who are watching this live, we are taping this on Tuesday, midday, which just so happens to be the time at which we have some pretty inclement weather throughout the state due to our hurricane/tropical storm Isaiah, depending upon what the wind speeds are at the moment. So if there are some issues with, shall we say, power or connectivity, hope you'll just bear with us as we kind of navigate this, just like everybody else is throughout the state of New Jersey. Also, Dr. Winters, for those who may not be familiar with this process, we will go for about half an hour. We will try to work in some of your questions as well. Again, please bear with us with any technical or connective issues. But if you want to watch this after the presentation's over, it'll be on the Facebook thread, it'll be on our YouTube channel, it'll be on our LinkedIn page. You can find a link on our website, atlantichealth.org. And of course, it airs in its entirety on News 12 Plus, Saturdays and Sundays from 8:30 to 9. So, with all of that having been said, Dr. Winters, thank you for your patience as we work through that. Let's start first, as we often do with these discussions, with a little bit of level setting, kind of where we've been, where we are. Can you take us over as quickly as we can, I suppose, or as broadly as we can, over the last couple of weeks?
Sure.
What's it been like being a pediatrician and working with your patients and their families in light of everything that's been going on lately?
So in the past couple of weeks, what we have found is that for the general pediatric field, we have been going back to basics per se, with trying to reestablish primary care settings and primary care management of our patients. We've also seen that we've had to modify quite a few things, especially when it comes to being able to treat our patients who may be acutely ill, because we know that there is still a possibility that some of our patients may have been exposed or may even have contracted COVID. So we have to make sure that we are keeping everyone safe and involved. So that's been the biggest thing, is trying to get a sense of normalcy again within our own selves and with our own clinic.
Have you felt any apprehension about coming back from any of your patients? Anybody who said, look, can we maybe put this off a little bit, or has any of that tension been there, or have most folks been more interested in getting back in now that we've seen the case numbers of COVID in New Jersey plateau and then drop significantly from where we were at our peak? Has that anxiety still been there?
So yeah, I would definitely say that there has been a mixture of both, right? Sure. So we do have several of our patients who have expressed anxiety or some concern about being able to come back into clinic. But the great staff that I have at the Pediatric Health Start Clinic has did a great job with being able to reassure a lot of our families. As a pediatrician, one of the things that I pride myself on, that I pride our staff on, is being able to make sure that we provide a comfort level to our patients, to be able to say, we understand your concerns and your fears, and these are the things that we're trying to do to be able to make sure that we're providing the most safe and effective environment for you. And I find that most of my colleagues are doing the same thing, so we're seeing more of our patients being able to say, you know what, I'm willing to come back now.
For folks who want to learn more about Atlantic Medical Group and the physicians like Dr. Winters who practice as part of it, you can go to our website and you can see on the little Find a Doctor link right towards the top of the webpage where you can look up pediatricians or really any specialty that you may have a need for or an interest in. Dr. Winters, really the last couple of weeks have been primary for parents, I'm sure. The issue that's been weighing most on their minds has been August is going to be over before we know it. And that means back to school is going to be an issue that we're all going to have to face and navigate. And I know that we're going to split this out a little bit. Our conversation is not going to be to talk about what politicians or policymakers have been doing.
Definitely.
But really, in any event, no matter what happens, what are the things that you as parents need to know about? let's start with just the fundamentals, the blocking and tackling of a back to school time frame before we get to anything COVID related. What are the types of things that parents need to be doing to get their children either ready from a health perspective or informed from a wellness perspective before they go back to school? What are the types of things you would normally be telling parents right about now?
So the first and foremost thing that we need to make sure is that our patients have received a school or annual physical. This is important because not only is it to help to make sure that our children are immunized and up to date on their immunizations, but we also want to make sure that we're providing what we call anticipatory guidance to be able to help them to understand there are so many other factors that come into play with starting back school. We have children that may have anxiety about going back into school, not even if we take away COVID, but just being back in that social setting again.
With their peers.
Exactly. The other thing that we want to make sure is that we're looking to, for the general health overall of our patients. So during a well child visit, not only are we going to think about immunizations, but we're going to also think about their weight, their height, making sure that we take their visual acuity and being able to do a hearing screen to make sure that these children are in the best fit and shape health that they can be in to be able to make sure that they can have an optimal health for learning. And so that's so critical that a lot of times we negate as a community as a whole to think about our children need to be in the best health in order to make sure that they can learn.
Those things seem like they would be valuable, perhaps more so at the start of a school year, but just sort of in general, that they're valuable, whether it be in the wintertime or in the springtime or moving into the summertime. Have you seen, and this harkens back to our conversation just a few moments ago, have you seen folks delaying any of that care? And if so, what is the risk of not doing that? And again, this is outside of COVID. This is strictly just for the general well-being of children. What is the downside of not focusing on those important issues you just talked about?
So there's several different downsides to this, and just to name a few. The first downside that we see is a lot of times when children are entering in, and this is where, when we think about the field of pediatrics, we really have to think about the wide encompassing age groups that we have and how that can affect. So if I'm thinking about children that are just entering into the education system, so our preschool and our kindergarten children.
That like 3, 4, 5, 6 kind of area?
Exactly. So these children, if we do not catch the fact that they may not be able to have appropriate hearing, so they may have hearing impairment, that can affect not only their language development for their speech, but also their reading comprehension. They're fighting an uphill battle to be able to have an appropriate level of training to go to the next step in education. So that's just that group. Then we start to take a look at the school-age children, and we think about not only the fact that we can catch a lot of these children who may have elevated blood pressures, they may have risks for comorbid conditions associated with obesity that we may not see. So those are all concerning that we want to make sure that we're looking at when we do physical exams and where we want our patients to come back.
I want to acknowledge both Tara and Susan who have been asking some questions. We're going to get to the questions that have been submitted in just a moment, so I appreciate you for doing that, and anybody else who has some, feel free to ask them, get them into the queue, and we'll try to get to as many as we can. I want to get through a couple of our some other topics first before we do that though. And I want to pivot now to obviously the elephant in the room, which of course is what are we doing now in light of COVID to make sure kids are safe? And so let's start first. And I know that right now, district by district, things may not, your district may be doing different things than the district in which I live in. Kids who go to school, private school may be doing different things than some of the in-district kids are. So I know that not one thing is going to fit every scenario.
Sure.
But let's start first with what we know that is a little bit universal. What do we know right now about how COVID is affecting school-aged kids? And I know there's differences even between the young and high school age.
Yes.
But as much as we can, let's talk a little bit about how COVID is affecting children to the best of our knowledge right now, and then let's dive into what some things or that we could do to make sure we're protecting kids as they go back to school?
Sure. So what we do know right now is that when you take a look at the morbidity and mortality that's associated with COVID infections, our younger children have not seen the same rates as some of our older children. We do know that there are complications that can be associated with being infected by, not necessarily a current infection, but if they were previously infected, with being able to see a multi-system inflammatory process that can occur in children. Mm-hmm. And so that can be concerning. Also, it can be concerning for our children that have comorbid conditions as well, such as asthma, such as even obesity, those things, especially in our older children. But we do know that the rate of infection for our younger children is seen to be not as severe as it is in our older children and adults. However, there is still a risk of being able to contract and to pass along COVID even in all age groups. We have saw research that shows us that. Mm-hmm. The biggest concern is when we start to think about how will that affect our home environment, how that will affect our community as a whole.
And by that, do you mean their ability to then, a student, for example, their ability to come home and let's just say the parent has a fairly significant health condition or perhaps a member of an older generation? Is it, I guess, what you might call the downstream effects of that? Is that sort of what you're alluding to?
That's exactly what I'm alluding to. We have to consider, case in point, within my clinic, a lot of my patients that I see may be in a lower socioeconomic status. Mm-hmm. They live in multi-generation family homes. So a lot of times the parents may be working and it may be the grandparents or it may be an older family member or someone with comorbid conditions that are helping to provide child care for that child or for the children that are in the home. That puts that individual at a risk of potentially being able to contract COVID, and then we can be able to see that those individuals will have more serious complications.
So what then can we do? Because I think, and I'd be interested in your opinion on this as well, for many children in New Jersey and around the country, mm-hmm. being at school provides nutrition, right? It provides that supervision during the day. The wraparound services that exist around school are very important for some families. So if children are to go back to class, what are some fundamental tips and suggestions that we can provide that people need to keep in mind? What are some ways that kids can stay safe?
So following basic protocol, which we know has been effective, these things are, number one, social distancing. Even seeing social distancing from as far apart as 3 feet has been seen to be beneficial. Mm-hmm. 6 feet obviously is optimal, but 3 feet can actually help as well. Wearing a face mask or face covering. Mm-hmm. One of the most important things is you want to think about the thickness of it. It's great to have a fabric, but we know even having a double or triple folded fabric can help to prevent the spread of droplets being able to be spread out when we cough, talk, sneeze, etc.
So thicker is better.
Thicker is better, exactly. Making sure that you use your mask appropriately, covering your nose and your mouth. There has been so many times where I've seen individuals will have the mask right underneath their nose, and it's like, well, that's defeating the purpose. Right. As well as avoid touching your mask, being able to use the sides for removing off of your mask, or even adjusting. Making sure you have an adjustable mask, so then that way you can prevent that slippage that goes below your nose, and we constantly see individuals having to move their nose up and down. And then last and most importantly is being able to have appropriate hand washing. And so obviously soap and water is best. However, soap and water is not always available, regardless if you're in the classroom, regardless if you're even walking down the street. Mm-hmm. Being able to have hand sanitizer that you can apply, that can cover the entire hand, and that you let dry completely, which should take about 15 to 20 seconds, mm-hmm. If done appropriately. So those are the main steps that I would say to be able to help with at least controlling the spread while we're thinking about going back to school.
I mean, you know this. We see many adults who aren't either willing to do this or don't do it or have been unable to do it correctly. Is it realistic to expect kids? Can we teach kids to do that? How responsive will kids be to this? Can we teach them to do this in a way that's effective and appropriate? What do you think? Are kids able to pick this stuff up?
Well, I will tell you like this, if you allow me to.
Sure, of course.
So my mom was an early childhood teacher growing up. And as me being a pediatrician, I can tell you there is a way that we can be able to help teach our children, but we do have to understand children are children. Just the same way as adults have a hard time being able to do these things, children can have a hard time doing these things. And not only is it a hard time to be able to do them, but it's also to be able to have that conversation with them to explain to them the reason why.
Right.
And I find that even when I'm having conversations with my parents in the rooms and when I'm seeing them in clinic, it can be a little bit alarming or jarring to be able to have a conversation where they feel as if they're promoting fear for their children, because no one wants their children to live in fear.
Yeah.
But being able to take that conversation and make it a more empowering conversation, that we have the power to be able to help prevent illness within ourselves, can take that essence of fear away and give it more of a power, a more sense of we can have a control over something that can feel as if we don't have much control at all.
That's a great point, because I want to talk a little bit about the mental health element of this as it relates to children. We touched on it briefly a few moments ago, but is that an often overlooked element of well-being for children? I mean, I just can speak from, I don't remember it being a topic of conversation when I was a kid about worrying about anxiety and fear and things like that in children. It was more of the physical well-being. How much do we now know about the importance of behavioral health and mental health as it relates to children? And how is that affected by what we're going through right now with COVID-19?
So the thing is that as we start to understand and get a greater appreciation of mental health in all ages, we start to see that we need to pay way more attention to our child's mental health. COVID has brought on such a different dynamic for everyone across the spectrum of ages. And even if you try to shield your child away from looking at the news or reading articles or seeing the internet, they still can sense your level of anxiety or your level of concern. And that's something that we can't disavow or say that that's not real. The most important thing is to be able to make sure that we're checking within ourselves, that we are secure and being able to seek the help that we need when we're having those issues as being caregivers of children, and then also making sure that we're providing for our children those resources. And there are several resources that are online that are available to be able to reach out to talk about this, to learn how to have this conversation. And the most important resource is your pediatrician.
Well said. How dramatic are the differences between the challenges that are facing your younger patients and those of the teenage years? Because we do see, unfortunately, and this was a topic of conversation I had in this very setting not that long ago, the unfortunate rise that we're seeing of the percentage of people infected with COVID being in that 18 to 24 age group. Now that's a little older necessarily than perhaps that you may be seeing for your patients, but those in those 15 to 16 age group, how are you advising those patients of yours, their families? Because social interaction is a really important thing for that age group. How are you navigating that and helping folks navigate that?
So one of the things that I would say is we have something that I saw a meme on social media that I laughed at, because it was saying if this happened in 1998 and you had your Nokia phone that didn't have any access to even
no FaceTime,
or
none of that stuff.
Imagine life, Lord. But being able to say, one, we do have those resources, but not only that, we have also found that we know that socialization is key. We know that we need to make sure that we create a sense of safe net around ourselves. So even if that's being able to create a safe space where there is one or two individuals that you have a trust system with, to be able to come together, still socially distanced, but to be able to have that social dynamic. I even practice that in my home. We have another couple that we will have a backyard barbecue with. We social distance, we have all of the parameters in place, but it allows us to not go stir crazy, to
You're
feel
outdoors.
as if, exactly. So we're trying to find the lowest possible risk, but to be able to still have that socialization, which is so important.
So I promised Tara and Susan and others who may be asking questions that we try to get to a couple of them. So Tara wants to know, is the key to keeping preschool aged spread of this disease low due to the steps that the adults are taking necessarily, the masking and those things, or is there a physical characteristic about young kids that may make them more resilient to the threat of spread? And I know that we talked about this a little bit, but I guess to essentially boil this down, is there something physically about kids that makes them more resilient to this? Or is it really those public health steps that we talked about earlier, or perhaps a combination of the two?
And that's exactly what I was going to say. I think there's a combination of the two. There's initial research that looks promising that says that there is some component of the reason why children, especially younger children, may not contract COVID as easy. However, it's quite difficult to say because the research is so initial and it's
We've only been doing this for a couple of, months. It feels like years, really? I'm sure, but it hasn't.
But it's been a couple of months. So it's kind of hard to put a lot of stock in it. And we've seen that in so many other pandemics with them as well. Even when thinking about like HIV, we saw that where it was so many different studies that came out. But once we're able to boil it down, because we need, in essence, time to be able to determine that.
Here's a great question regarding college-age kids who are heading back to campus. Parents lose a little bit of the oversight of kids who may be going back to campus. Not every school is doing on campus, though some are doing virtually. But for those who are preparing to send kids off to school, what's the guidance you'd provide for something like that? I mean, it's challenging enough to send your kids off to school at a normal time, let alone in the midst of a global pandemic. What are the types of thoughtful best practices you might give to parents to just plant those seeds in their kids' minds? This is a tough one, I'm sure.
So it's quite interesting because I just had this conversation with a patient and her mother yesterday. Yeah. She's getting ready to go off to college down south in southern Jersey. And when we had this conversation, the first thing that I stated was, you now have to make sure that you're taking the responsible steps. And what are the responsible steps? Making sure that you understand that not only do you want to protect yourself, but you want to also protect others as well. Right. And this is a part of being a grown-up that we have to understand. We're going to bump our heads. We're going to make mistakes. Right. You're not expected to be 100% perfect. No one is. Sure. But it's so important for you to understand that the actions that you take can affect so many others around you. And just having that meaningful conversation, besides talking about all the different steps which we know of, but having that conversation of, I trust you. And a lot of times, most of our teenagers want to feel that sense of trust.
So do they yes you to death when you say that? Is it, yeah, I got it, I know. Or do you think it resonates?
Some will yes you to death, but for the most part, most of the teenagers are way more insightful than what we give them credit for. And I think that she really did take it to heart.
I'll kind of flip it around for you.
Sure.
For teachers who may be thinking about, look, and teachers have their hands full prepping lessons and classrooms and all of that stuff under normal circumstances. And virtual learning has been a huge challenge, and we certainly acknowledge the work that our teachers have done in that space.
Thank you.
But for teachers who are now having to loop in public health guidance and how they deal with their students and having to explain these issues to students, from a medical standpoint, what would be some tips you might provide? Because these teachers may find themselves having to have the same conversations you're having with your patients, helping kids understand, why do I need to wash my hands? Why do I have to wear this mask? It's gym, I want to take it off. You know, what type of tips would you provide to them about things to think about? You know, ways to resolve these conflicts and to broach these subjects with children, much like you do in your practice.
Sure, and to be truthful honest with you, and having quite a few number of teachers that are in my life and that I have close relationships with, one of the things that I would tell them is the same thing I had to tell myself. As an individual who was a high-risk individual going back, and I never left. So as soon as the pandemic hit, I was still in clinics, still seeing patients, still having limited PPE, as we heard before. And I do understand the plight of the teachers, and I'm right there with you in all solidarity. You have to, one, feel comfortable within yourself, and have to think about all of the different issues that you have to deal with. And I think self-care is important. Mm-hmm. The other important thing is being able to make sure that as a teacher within your classroom, setting your classroom as an example, because we know that these classrooms, we're going to most likely use them as pods where the students will stay in the classroom
and not move throughout
and
the
not
school.
move.
Right.
So we know that you're losing your lunch hour. Instead of being able to prep, you will have children that will still be in your presence, that will still ask you for all different things. You're taking on a greater responsibility. And so the most important thing is being able to figure out within your specific scenario, how can you provide a limitation of having as much exposure as possible, whether that means being able to develop barriers, whether that means such as
desks not facing each other, maybe. Yeah.
Or even being able to make sure that we have a hand washing station, even if that's like a couple of bottles of hand sanitizer that's right there, being able to practice hand sanitizer, you know, using the old method of taking flour and making hands and then doing those things to see. All of those things are helpful, but I think that's also why it's so important to also for teachers to stress the importance that they need support from their districts as well. Mm-hmm. And I truly support that.
Well, one more on schools. In terms of, for parents who are trying to balance this concept of maybe it's safer, my child may have a comorbid condition, virtual learning may just be safer,
sure.
and they just feel more comfortable availing themselves of that option and not sending their kid to school. We have some, Jennifer wants to know, what are they missing out by not being there in person, that socialization element of it? We've talked briefly about how important it is from their growth, from an emotional and socialization growth. What do you miss out on that, and are there ways that you can supplement that as a parent? Or is there just, unfortunately, there's only one way to get that, and that's by having that level of interaction?
So I'll even take it a little further, if I may. Mm-hmm. One of the things that I had, again, just thinking about a previous patient that I had, who had a son with severe autism along the spectrum, and had to be able to provide all of the services that the school provides for them. Now, the parent is being able to receive the services through Zoom. However, the mom is finding that she has to do a lot of these things on her own, or trying to understand something that was explained to you by someone who has a master's in speech language
it's
pathology.
way more
It's way more complicated.
Yeah.
So that's one thing. A lot of our parents have a difficult time being able to even understand some of the teaching methods, because that's the reason why teachers went to school to be able to learn the teaching methods to begin with.
Right.
So that's the first thing. But in addition to that, not only are we losing a potential socialization within other kids, which is so important to be able to experience and talk to other people that are around your age and your developmental level, but also being able to have that sense of security. We know that a lot of our children may not be in home environments that is conducive to be able to learn, right?
Sure.
So
parents may be working and not all that.
Or you have multiple people living in a smaller area and there's no place to be quiet, to listen, to even concentrate on your work. Right. It's so many different dynamics that come into play with it, which is why I understand why my organizations of the American Academy of Pediatrics and the American College of Osteopathic Pediatricians have stated we need to encourage our children to be able to have in-school training. But as stated that we also need to make sure that we're providing safe spaces for our children to go back in, because both are so needed.
Dr. Winters, I have time for one more,
Sure.
and then Wendy wants to know, hybrid school opening, especially for kindergarten age children. Do you recommend either all in or all out, or can doing some remote and some in-person instruction be suitable? I know children benefit from consistency, at least mine certainly do. So is there a value in a more hybrid system, or are we sort of in uncharted territory here a little bit, and we'll have to see?
So I think there it's uncharted, but I definitely can see the benefit in a hybrid system of being able to have, even if it's those 4 hours or 3 hours of instruction that's being provided by educational specialists, if there is a possibility to be able to have the kids be able to receive that socialization. However, I definitely can understand how much of a strain that can put on parents, as well as it can put on society as a whole. Even though, yes, the children can go back to school hybrid, and our teachers may or may not be hybrid, the rest of us who are—
The rest of the world continues.
exactly, are not hybrid. So then that creates this situation of, well, who is going to take care of my child for the 5 hours that I'm still at work?
Right.
That becomes difficult. So I think the most important thing is understanding that this is not a one-size-fits-all solution. And that's why it's so important to have the school districts work with their families, as well as with the pediatricians and the public health sector, to be able to determine what is going to be the best for your specific district.
Dr. Winters, this has been a fascinating conversation, and I appreciate you carving out some time for us.
I thank you so much for having me. I really appreciate it.
Awesome, awesome. Well, and thank you to everybody who tuned in and watched today. Again, if you missed any portion of this, or if you joined us a little late, you can catch the entire thing on our Facebook page, or on our LinkedIn account, or on our YouTube channel, or on News 12 Plus, or on our website. We make it very easy for you to find the whole thing. So you can also catch any of our previous community conversations there as well. So again, for Dr. Tyree Winters, my name is Luke Margolis. Thanks so much for joining us, and we'll see you next time.
Have a good one.